Well, why don't you give us a little quick explanation? We have 2 minutes to give this answer of the type of people that will greet the people all the way through the surgical experience until the end of their experience. A 2-minute cap of what somebody can expect. This is a tough chore.
Okay.
What you can expect when you show up, a brief synopsis till we wheel you to your car.
Okay. You'll come into the main lobby, you'll check in at the front desk with a receptionist, and then a nurse or a nursing aide will take you to your pre-op room. You'll be quickly seen by a pre-op nurse who will ask you a series of questions, and then proceed to start an IV. All of our anesthetics require that preoperative IV.
And that's just a tiny little pinch.
Little tiny pinch, and the nurses, those nurses are excellent. They do, you know, 50 to 60 IVs a day. I mean, they're very good at that. And then you'll meet your anesthesiologist, who will come in and talk to you, do a history and physical, ask you questions about previous anesthesia, family history of anesthesia problems, explain the anesthesia plan that's going to be tailored to you based on your surgery and your medical history.
And you have already read their records before you even go in the room.
Right. We've already, me and my colleagues, we review our patients the day before, the night before, to make sure that we are prepped before we even go in. And then the morning of, we review those charts again.
Check their blood work.
Check all the labs, the studies, the EKGs, heart scans, what have you. Then we go in, do our assessment and our interview, explain the plan to you. You may receive some medications depending on your type of surgery that morning via pill. After that, you're ready to go to the operating room, and we administer a mild sedative or relaxing medication on the way to the operating room. So by the time you get into the operating room, you're already drowsy and have no memories of the process of going in the operating room. At that point, you have your anesthesia is begun, your surgery is done. You come out of the operating room, go to the recovery room, where you wake up from anesthesia, typically about 30 minutes in there, and then you go to what we call a phase 2 recovery room, which is a room that's a little bit more family friendly. You can sit up in a chair, watch TV, get something to eat, something to drink. We watch you for another hour or so just to make sure your pain is under control, you're not having nausea, you don't have any questions.
No lightheadedness, that you can walk.
Right, make sure you're safe for discharge. Your surgeon will usually give you some post-operative instructions, and the nurses will do the same. And then you'll be escorted via a wheelchair out to your car.
Where somebody else has to drive you home.
That's right. And we always say you must have someone to stay with you for 24 hours after your anesthetic.
Again, focusing on the complete program of safety that we embellish.